Hello, my name is Michael Weiss. Welcome to the video podcast here called A Crohn's Disease Life. Thank you for watching if you haven't checked out the show before, and for those of you who have been watching, thank you. You've all been tweeting me while I'm in the hospital here at Mount Sinai in Manhattan, and I really appreciate that. It's engaged my mind, engaged my heart. I'm very appreciative for people wishing me well, so I thank you. My Twitter address, by the way, is just hospital patient, one word, if anyone wants to get in touch with me. Okay, the topic for today's show is, excuse me, I'm not well, so excuse me. Can hospitals offer a consumer-friendly experience? And I say that because we as patients are consumers now. I think we know that, and I think the powers that be know that. But can a hospital actually do it? And when I mean can they offer a consumer-friendly experience, I mean, can they run their business like Apple runs their business? I mean, can they come up with an experience or a service? I mean, no one is going to say, wow, you got to have your hysterectomy at Mount Sinai Hospital. They are fantastic. I mean, I'm not saying let's go that extreme, but I'm saying that, hey, I was just at Mount Sinai for 3 weeks, and really, great experience. I trust them emphatically. I don't think we're there yet. It's nothing against Mount Sinai. I just happen to pick that name because I'm here. But I think hospitals have to start becoming consumer-friendly businesses because that's where we're going. So let me just address a couple of topics. I'll try to be in and out real quick. Number one, don't assume anything. And I say that, let me give you a little story. It happened yesterday. I had to have a CAT scan, very important CAT scan. The surgeons are waiting to see what the results are. So they make me drink 20 ounces of contrast, and which is very difficult for me. I've been, unfortunately, not been able to keep it down, and then it causes a whole chain of events, which is very painful and uncomfortable. But I did it. It's a good study. I want to help the surgeons. When they started coming to get me, the transport team, they gave me a consent form to sign, which is routine. But I looked at it, and it said I got to have an injection as well of CAT scan dye. I'm allergic to CAT scan dye. And when you come into a hospital, it's the first thing they ask you. I'm allergic to 2 things. And they write it all over your chart. Some hospitals make you wear a red band stating what you're allergic to, so no one gives you the medication by accident. Now, I might not have picked that up because I could have gone down to CAT scan, fallen asleep, and I have this PIC line right here. They could have easily tapped into it. I was so annoyed. But, okay, people make mistakes. That could have been a deadly mistake. That bothered me, and that's not specific to Mount Sinai. That could happen anywhere. But what really bothered me about it was that they were rescheduling the test for today, Saturday, the next day. So I had to drink another 20 ounces of the contrast Saturday morning, which I did. But I was so distended, meaning my stomach pushed out like Santa Claus, from the 20 ounces yesterday that I was fearing what was going to happen today. And it did. I've been in agony all day, and I just got a little respite. That's why I wanted to do the podcast. So don't assume anything. No matter how smart people are or what their reputation is or if they went to the greatest schools in the world. However, having said that, always be polite. Now, I don't always practice what I preach because yesterday I think I flew off the handle a bit. So, and I must apologize to who I did that to. But you need to be assertive but polite. Now, I know CNN, the television network, the cable television network, is running a series, I believe, something called The Empowered Patient, and how things have changed. Listen, it's true. Doctors, I think they always listened to patients, but they didn't hear what we said. Now they're listening and hearing. And I think it would be great for doctors to also offer a social media part of their plan, meaning you get 15 minutes of Twitter chat with your doctor if you're going to have a surgery. If you want more time than that, you have to pay for it. But that should come along. It would make their job a lot easier. And for a lot of patients who want more time, it would be a great way for doctors to monetize their practice in a very cutting-edge way, sort of like how Ford is embracing technology. But I'm just digressing a bit. What I'm saying is that doctors listen. They never used to hear. Now they hear. But it doesn't give you the right to be rude or impolite. And yes, you should feel empowered, but you know what? We don't like the God complex that some doctors have, and sometimes it's necessary for surgeons to think they're God. You don't want someone operating on you who's like, well, I don't really know I don't know. You want someone who's like, yeah, I'm going to get you better. I know what I'm doing. I got no problem. Whatever happens, I can handle it. That's who you want operating on you. So you have to understand that. But if the person doesn't listen to your questions and doesn't hear them, that's a tough doctor to deal with. But as a patient, Yes, times have changed. Just be polite, be courteous, okay? Next, I firmly believe, based on my experience, that there are expiration dates on hospital stays. I mean, once you hit the 2 or 3 week mark, it's tough. Things start to fall apart, both in your mind, how you can deal with things, and also much like when you have a car that hits like 90,000 miles, and then it's like your 20th breakdown, everything breaks. So when you have a TV, 5 years, and all of a sudden the remote goes and the TV goes, it's time to get a new TV, it's time to get a new car. With hospitals, it's very difficult. After 2 or 3 weeks, it's insane in a hospital, and I don't understand why that is, because they're a business, so they should be able to give you the same experience every day. But as I've said in previous podcasts, for some reason, at night or on the weekends, it's a very different experience. It's like you're not allowed to get sick on the night or during the weekend. So I guess what I'm saying is try not to be in the hospital more than 2 weeks or so. And if you are, just understand that no one's perfect. It's a very difficult experience. And after 2 weeks or so, it gets sort of progressively worse. And again, it's no one's fault. It's no one's intent. But for some reason, and people who are in the hospital a week will tell you great things about it. But I'm telling you, if they're there more than 2 weeks, and I've been there many times, as have many chronically ill patients who are probably listening right now, watching, listening, etc. Keep that in mind. Now, the last point really is I wanted to compare when I'm talking to nurses. Nurses, excellent nursing staffs at hospitals get what's called Magnet, M-A-G-N-E-T certification. And what this is, it's some sort of governing body that's authorized, I think I have my notes here, it's authorized by the American, I think, Nursing Association. And it's extremely prestigious. They have to work very hard to get that. It represents the strength and quality of the nursing staff at a hospital. Now, I used to think, as I've been to many magnet hospitals, they look like hotels. The nurses are incredible. So you'd think, oh, I'm going to a magnet hospital, it's going to be great. Well, the nursing care will be great. But the story that I just told you about what happened to me yesterday was a failure to communicate amongst doctors and nurses. It wasn't anyone's fault in particular. It was everyone's fault, and it could have killed me. So what I'm saying is that it would be great if there were a patient certification for it. Maybe just chronically ill patients, because we know better than anyone. And maybe sprinkle in a couple of patients who've had procedures for a couple of days. But unless you get the patient side of things, you're not getting the whole story. Yes, I've always said it, doctors give orders, nurses execute them. Nurses clearly are the most important puzzle in the healthcare system. However, it's not the whole thing. Think about it this way. When I wrote my book, a doctor who was sitting in the same room as we were on the board of some company, he said, what do you know about being a hospital patient? You've been hospitalized a lot, but come on, you're a lawyer. At that time I was practicing law. I asked him, I said, how much time do you spend with a particular patient when you make your rounds? He says, 15 minutes or so. I guess each health plan has a different time or whatever, or depending upon the seriousness of the patient. I'm like, do you know what goes on the other 23 hours and 45 minutes in that patient's life in the hospital? What goes on at night? What goes on the weekend? He had no answer. Now, there were some nurses who work like 8 to 10 hour shifts, I think, but some have worked every shift. They've worked the morning. They've worked the graveyard shift. That's why they're great nurses, because they really understand what happens. But I don't get it. I mean, it's a 24-hour experience, so if patients could give feedback, and you also have some nursing magnet feedback, then you got yourself an excellent hospital. So, listen, I'm sick now. Right now, I'll be better soon. It's not something I want to tackle, but I would love to help someone do it, and maybe someday I will do it. But patients need to have a voice in determining the quality of hospitals, because it's a consumer experience. Okay, I'm going to end on that and just say again, my book, Confessions of a Professional Hospital Patient, at hospitalpatient.com. You can reach me on Twitter. My name is Hospital Patient. And please subscribe to this YouTube video, podcast, blog, whatever we got here, and tell your friends about it. I really appreciate it. And stay well. And if you have any suggestions, you can email me at michaelweiss@hospitalpatient.com. And anything you want me to address, I will. Thank you.